And we're live.
Thank you. So I'm Gale Brewer, Manhattan Borough President, and I want to thank everyone who's joining us this evening to talk about an incredibly important topic. It's called Childcare After COVID. We have an amazing panel. I certainly want to thank the Mailman School of Public Health at Columbia University, who is our co-sponsor, and we'll have an amazing participant who is a member of the faculty there. This is a topic. We can rethink childcare. Certainly we can try to do that. We also have to think about health, of course, and of course the viability of the center. Those are sometimes two challenging topics in the same space. We have to think about the information for the family, the parents, the child. We have to make sure we have the facts. And I know that the city agencies are working really hard on that. We have to talk about advocacy, and we'll hear about that. And of course, we have to talk about equity. It's a very important topic. And I, again, want to thank Columbia University. If you have questions, you can put them in the chat. If in fact, we don't get to all your questions, because we have a lot that even come in pre-discussion, then we will make sure to get answers for you. And if you want to know more information, there is a phenomenal website, neighbors.columbia.edu/childcare after COVID. And that particular site is full of information. And I want to thank Columbia University also, because we've had several topics in the past on small business and education and so on. And that particular site is the host of all of those discussions. So without further ado, as I indicated, we have a phenomenal panel. I want to start with Corinne Schiff. She is the Deputy Commissioner for the Division of Environmental Health at the New York City Department of Health and Mental Hygiene. That particular division works across a wide range of subject areas, and it prevents and controls illness and injury related to environmental and occupational health. It obviously participates in outreach and education, surveillance, enforcement, very complicated topic. Prior to joining the health department, Ms. Schiff was a staff attorney at the ACLU, a litigation fellow at NRDC, also known as Natural Resource Defense Council, and she was a law clerk at a district court, a federal district court in Manhattan. She earned her bachelor's degree from Brown University and a law degree from Georgetown University Law Center, where she was the editor of the Georgetown Journal on Fighting Poverty. And she has a long record on social services. And I know from personal experience, she's an amazingly talented, but also responsive public servant at DOH-MH. Corinne Schiff, go ahead and help us understand some of the amazing challenges, but also how your wonderful department is addressing them.
Thanks so much, and thanks very much for inviting me. I'm really happy to be here to talk about this critical topic. Childcare is obviously a key part of New York City's reopening, and having access to high quality early childhood education is key to setting children up for a lifetime of good outcomes. In New York State, childcare was deemed an essential service and was never closed by New York State. Back in April, as New York City was experiencing widespread community transmission of COVID-19, the health department went to the Board of Health and recommended that the board require childcare programs to close temporarily as a mitigation measure. And so the board did that back in April, except for emergency programs. And so the childcare, city-regulated childcare was limited to emergency programs serving parents, children whose parents were essential workers. Last week, and an important, I think an important milestone for New York City's reopening, we went back to the board and recommended to the board that now that New York City has slowed transmission of COVID-19, that temporary closure order was no longer necessary. The board agreed, lifting that closure order, allowing childcare programs to reopen as of Monday, the 13th of July, when they're ready. Since April, actually in June, New York State issued requirements, COVID mitigation requirements for childcare programs. They're quite comprehensive, and childcare programs are able to reopen when they are able to implement those COVID-19 mitigation measures. Those measures really align with what we call at the health department the core four. And these are things that we are talking to New Yorkers about as we all learn to adjust to COVID-19 in our city. The core four, I want everyone to remember these. These are stay home when you're sick, wear your face covering, keep your distance 6 feet away as much as you can, and keep your hands clean. Wash your hands or use hand sanitizer. And the child care mitigation requirements are variations on all of those. What I can talk about tonight, and I look forward to your questions, is because New York State has issued the requirements, we see the role of the health department in New York City as being here to help child care programs implement those measures. So we have developed resources, an FAQ, tools for keeping track of things, a checklist for programs. We're holding a series of webinars so that child care programs can hear us talk through these requirements. We can take their specific questions. We'll be offering technical assistance to programs that would like more individualized attention. And we really want to get the message out to childcare programs and to parents. Childcare is going to look a little different now, and we're all going to adjust to that. So I'm happy to be here, happy to take questions, and thanks again for including me.
Well, thank you very much. Our next speaker is Dr. Virginia Rao, who is a professor at our sponsor, the Columbia University Mailman School of Public Health. And she is an epidemiologist and a social worker, and she's focused on long-term child health effects of toxic social and physical environmental exposure. She's an expert on neuroscience. She has studied the impact of young people in their experiences in terms of toxic experiences, built environment, chemical hazards. I think of tobacco and pesticides, on pregnancy, on maternal, on child and family health. She's been the principal investigator on many, many research projects, focusing on insecticides, secondhand smoke, and all the challenges that young people and their brain experience. She's been participated in trials for low birth weight infants, and she has a multi-level analysis on the impact, which I think is so important, of Head Start on New York City children. She has been on numerous national committees with many, many national organizations like the Environmental Protection Agency, NIH, EPA, and many, many others. She's also the director currently of Trauma Free NYC, which is a New York City partnership for trauma-informed action. Dr. Rao, thank you for your sponsorship, and thank you for being a panelist. And we look forward to hearing about all the public health issues and some of these larger early childhood development challenges.
Better. Okay, so I want to start by saying that during these challenging times, our children continue to grow and develop and learn despite COVID. So some of the tremendous challenges that are facing us today are in the context of the COVID experience. So it's an important time to think about how we can foster resilience, not only for the whole family, but for the community. I want to preface these remarks by saying briefly that, many of the challenges we're facing with respect to work and childcare are really systemic. And by that, I mean that our whole society may need to reevaluate how we set priorities, our pay structures, how we define essential workers. Being tired and anxious during this time doesn't mean that as parents, you're not resilient. I think most likely you're facing, and we are facing together, somewhat of a burned out, we get burned out by a social system that has not really figured out a way to prioritize working parents. So the reopening of childcare facilities is arguably at least as important as the reopening of many other businesses in New York City. So just a couple words about how we ensure that our kids continue to thrive in these very uncertain times. We can start by recognizing that they need all of the supports that they normally require from families, childcare, and school settings. And this includes high quality caregiving in homes, in schools, and in daycare settings. Despite the increased hardship and stress of the COVID epidemic, and maybe because of the increased stress, let's remind ourselves what kids need. So just 3 things. First, they need responsive interactions with reliable caregivers. The give and take, the back and forth, some people refer to it as serve and return, to help build healthy brains and bodies. The science of child development has shown that this sort of interaction is critical for healthy development. Second, kids need social interactions and connections. And this includes connections with other children, as well as responsive adults. Third, they need safe, supportive environments where they can feel secure, especially in these uncertain times. So how do we provide high quality caregiving during this particular epidemic and the long tail of the epidemic? First, let's try to reduce some of the sources of stress. So reduce the negatives by establishing regular schedules. And we do this at home. And certainly this is supported and encouraged in a high quality childcare setting. Regular schedules for eating and sleeping and playing. This lessens the uncertainty of an unstructured day, particularly in these anxious times. So we need routine. This helps to regulate a child's behavior. Along with this is exercise, good nutrition, and this goes a long way toward maintaining healthy bodies. Second, let's try to increase the positive side of the scale by maintaining connections with family and friends. And all of us and all of you watching, I'm sure, have been doing this, even if it's limited to phone calls and video chats. Again, it reduces isolation, lets children see that family and friends are still there, and permits sometimes even opportunities for games and other kinds of activities. And third, it's important as caregivers, parents, providers, that we practice good self-care. You need to take a few minutes for yourself, even if it means going for a walk, getting plenty of rest. That may be difficult. Give yourself a break, even if it's just for a few minutes, and try to plan some relaxing rituals. And sometimes it helps to confide in a friend, try to get together, at least virtually, to share with other families the tricks that have worked to entertain. So just a couple more things. Now that childcare facilities are opening up, let's remind ourselves of the very important benefits of high quality childcare, how it's important for child development. First, high quality and foremost, high quality childcare enables parents, working parents, to get back to work and to be able to get back to work with confidence and not worry that their children are not being well cared for. So high quality childcare has both social and strongly economic benefits for everyone. These are also places where parents can interact with other parents and get information and additional resources. Secondly, high quality childcare provides kids, even young kids, with a schedule. Third, childcare provides times with peers in a safe environment during which children have an opportunity to learn how to problem solve, to socialize, and to learn together. Fourth, high quality childcare provides interaction with other adults as positive caregivers, and they can guide children in their development and the building of trusting relationships, which really extends a healthy home environment. Fifth, childcare can give your child a head start in brain boosting activities, and it can foster excellent child development. Sixth, high quality childcare can help kids to adjust to formal schooling, particularly among younger kids, ensuring a smoother transition to school or to the next grade. So I want to say just in closing that these are all basic principles of child development, and many folks are very familiar with them, but let's not forget that we live in communities and the context is most important here. So caring for our kids is really a community job, not just a family job. And we do need to figure out ways as a society to support our child care providers, and they need to be able to support the families in our communities.
Thank you very much. And I just want to say how correct you are about the economy and working, because I sit on the governor's recovery task force. It's a small group, and we talk with labor, business, other borough presidents, other agencies. And of course, the business folks, first issue is childcare. You might think it would be something else, but the first issue the business representatives bring up is, what are you doing about childcare? And this has been going on for months. So it's nice to hear it from them, in addition to you and the people who care. Next, our wonderful panel includes Dr. Michelle Page from University Settlement. She is currently the Associate Executive Director for the Settlement's Early Childhood Division. And I don't need to tell you how much I love the settlement houses. Her career in education began over 25 years ago as a public school teacher in Queens. And now she has transitioned into leadership in the New York City early childhood programs. She earned her undergraduate degree from St. John's University and graduate degree from Queens College, both in New York, of course. And she's got certificates in pre-K and elementary education. She got her doctorate of education in executive leadership from St. John Fisher College. And she's been part recently of Columbia University's Senior Leadership Program for Nonprofit Professionals, which we know is an excellent program. She's proudly an adjunct professor at Lehman College, and she's an active member of the Daycare Council of New York's Advisory Committee. And she's completed her membership in the Black Agency Executives Agency, which is also a wonderful organization. Dr. Page, thank you. We look forward to hearing from you. And I am such a settlement house advocate.
That's great to hear. Thanks for having me tonight. Thank you to all my fellow panelists. A lot of you have already echoed some of the sentiments of early childhood community-based organizations throughout the city. I'd just like to tell you that I'm really proud to be in the leadership team for University Settlement, both as part of the agency and part of the early childhood division. Settlement houses, as Borough President has so eloquently stated, are critical to the community. We are essential workers and are pretty much the defining people of essential workers, going into communities, finding out what the needs are for the people in neighborhoods. We have not closed. We have just shifted our target to virtual spaces and reinventing what we're doing to fit the needs of the community. Along with Meals on Wheels, adult literacy going remote, the early childhood had to very quickly, the week of March 13th, close our shops down and go to the virtual space for early childhood education and care. This is week 18 for us in this new space. And I know this because we've been counting up and counting down and counting over. And we're excited about now having a kind of like a starting point for the conversation of opening. We do think it's a little bit premature to put children and staff together in spaces, especially since we can't have, food in a restaurant at this point. So we're a little bit concerned about having people congregate, but we're confident that with the partnership of the Department of Health, the Department of Education, Borough President, Office of City Council, and all of our community-based organizations, we could come up with a plan that's safe, respectful of both children and families, respectful of the workforce, because many of the workforce are also parents who have to navigate putting their children back into school spaces as well. I come to this panel from the perspective of commiserating with my fellow community-based organizations. We have a lot to think about. We have a lot to navigate. We have guidance that has been put out, and we really are excited about being part of the conversation this early in the reopening panels and discussions. So thank you for having me today.
Thank you very much. And I just want you to know how much I love settlement houses.
We love them too. We love them too.
Well, I just came from Union Settlement in East Harlem.
That's my alma mater. Yes.
Yes. And we just did a peace march to stop the gun violence, sponsored by Union and also other organizations. So thank you for all the settlement house work that you do. Our next amazing panelist is Mai Mill of New York. She is the Senior Research Analyst at what we call DCCNY. Her research supports and advocates for early childhood programs across our beloved city. She has focused on evaluating an early childhood career ladder program, determining the cost of pay parity for early childhood educators, an incredibly important issue because they are all mostly, I wouldn't say all, mostly from community-based organizations and advocating for community-based early childhood programs at NYCHA, the New York City Housing Authority. Prior to joining the Daycare Council, her research examined the effects of No Child Left Behind on children of immigrants and the Black-White achievement gap. She holds a degree in social work from the University of Wisconsin-Madison and a master's degree in social work from Columbia University. She comes from an immigrant family and attended Head Start as a child. And her mother was a family childcare provider. So she's very special to us. My Big Stick, thank you very much for joining us. And we do love your organization and we look forward to hearing what you have to say. And thank you for your research.
Thank you so much. Thank you to you, Manhattan Borough President and Columbia University for hosting this town hall on such a critical issue. The Daycare Council of New York has been around for over 70 years. We are a membership organization of 93 agencies that operate over 200 publicly funded programs across the city. We also have a family childcare network out in Jamaica, Queens, and we've been advocating for over 70 years on these very issues. 2 weeks ago, we released a report on the emergency childcare programs that have been operating during this pandemic. The DOE has funded these programs. They are based in community-based organizations, and they've been serving essential workers throughout the last several months. What we were really interested in is finding out on the ground what has been working, what hasn't been working, and can this be sustainable? We interviewed 9 centers, directors of childcare centers, and 4 family childcare providers. And these interviews were an hour, sometimes more than an hour long. We wanted to really make sure that the voices of these childcare providers were heard. And what we found was they all felt a deep sense of pride in being able to serve their city during this critical time. They were proud to be able to watch the children of essential workers, but they also felt a lot of anxiety about the financial viability of their programs. With so many of them had to shut down that some families had left the city. They were only operating on very thin margins to begin with. So the pandemic put their businesses in a very precarious situation, but they did step up and they did serve the essential workers. So their voices really need to be heard during this time when we're talking about reopening. We found that there were new normals that childcare providers were able to adapt to. So family providers, family childcare providers and center-based providers, they had parents drop off the kids at the door instead of entering the centers. Staff and children wore masks. Toys were disinfected regularly throughout the day. Children were put into pods or were stationed at activity centers to avoid congregating and to maintain social distancing. Meals were served individually instead of family style. So there were new normals that centers were able to adapt to. But what we were really concerned about was whether or not any of these practices could really be scalable. And when we talked to the providers about that, there was a lot of uncertainty about what it would look like when these centers actually opened up to more than just 10 children in a classroom. And I think that's where we are right now. Is I think everybody's still unsure about what this is actually going to look like. We have parameters on what we know is safe and good practices, but I think Michelle can probably speak to this as well. We don't actually know what it's going to look like once the kids are actually there. So I think that right now there's still a lot of uncertainty, and certainly we're not sure if centers should even be reopening, given that public schools don't have a plan yet for how they're going to reopen. So there's still a lot of uncertainty, and we can't say, what's going to really be working yet.
Okay, thank you so much. And thank you for your report. It's excellent. I read it and it's something I think actually, Corinne Schiff, you might want to suggest that all the centers read my report because it had a lot of suggestions. But I do want to know, because that is, as you heard earlier, Corinne, some of the challenges of just how do you open? Because I know that centers are going to be asking you, and how do we coordinate with other city agencies. I'm certainly not going to ask you anything about the Department of Education because that's a different topic. But is there any coordination with DOE? And also, you know, because we won't know, according to the governor, until August-ish, whether schools are going to be open or how they're going to be open. You know, 2 days for some children, for the children with IEPs are supposed to be full-time. How are we going to be able to coordinate so that the childcare centers, because it's not only, as I said earlier, a health issue, it's also a viability issue. So I don't know, poor Department of Health, mental hygiene, because you're stuck with every challenge imaginable. But I just want to know, how do you envision some of these challenges that you have already heard about from all the childcare centers?
These are all very, very important comments and questions. And I think, you know, I think that every childcare program may be answering these questions differently. As I noted, we're hosting a series of webinars to help childcare providers understand what the requirements are on paper and help them think through just kind of things that Maya's talking about. How are you going to do that in your own program? What's going to make sense for your families, for your children, for your space? Things may look different to different programs depending on where they operate and what their space looks like. But I think what you've heard from the other panelists too is how important childcare is for children and for families, and it's a key component to how we all live our lives. So the health department is here to help programs understand what is required, how to implement these requirements to reduce risk of transmission of COVID-19. And I think we're all in this together for many, many months. And so we're going to be learning together as we try new things and adjust to what I think will be a new normal for some time. We are working very closely with the Department of Education. So I do want to assure you of that, and trying to get the messages out to childcare programs, whether they're in a DOE contracted program or not.
Okay, so webinars will answer things like how to do physical distancing, and if they want to have classrooms added to their licenses and timetable for approving different things. That's the kind of thing that the webinars will do, I assume,
So
and many others.
Yes, so we're going to walk through all the requirements and we'll take questions and things about timing for your own, for individual childcare questions. We're going to ask people, we're going to refer people to their borough offices. Everyone should know their contact person and to get some of that individualized technical assistance.
Okay, so Dr. Rao, you gave us such a wonderful, absolute reason to have early childhood education. I wish that it was on billboards all over the city and the world, because to me, nothing is more important. And to the credit of the mayor, pre-K is helping to address that issue. But I guess my question is, what do you see as the new norm for childcare centers going forward? Not necessarily what DOH would answer, but in the broader sense, will some of this new norm be able to address the high quality and the other really important characteristics that you listed? Do you think it's maybe that's hard to answer, but I think that's what people want to know.
Well, I hope so. I think that we do have to approach it as a system, not just as individual childcare providers. And I think that we have to be more nimble so that some childcare providers have systems and some schools have systems where we have families are paired as buddies. There have to be strategies so that if we have to pull back again, and I hope that's not the case, but if that happens, that families have increased resources and can kind of, maybe the word pivot has been a little bit overused, but that people can sort of figure out a new way to get through the next week or two using maybe some interim childcare, maybe buddying up with other parents. It's a community problem. And I think, still our society doesn't really approach childcare in the most really wholesome way. I think it has to be considered incredibly important to child development and to community health. And I'm just not sure we're there yet as a society. Maybe this will draw attention to the fact that this is incredibly important for our survival. And certainly the pandemic has done that, has shown some very unpleasant inequities, that's for sure. But maybe this is an opportunity to rethink how we do childcare in relation to the work setting, the workplace, and to think about how communities band together to make sure that we don't have gaps in this system and that we can move quickly in the event of this type of crisis.
Right. So, Dr. Page, thank you again. My question to you is, because you are on the ground in a settlement house, and I'm wondering, we're all talking about viability in addition to all the health concerns. And, it's viability in terms of the center, and it's viability in terms of the families either paying for it or having enough subsidy so that the families don't have to pay for it. So I'm just wondering, because I know that you also said you're part of the Black Agencies Executive, an organization for which I have great respect. So I'm just wondering if there's a lot of discussion about viability for all the childcare options, not just during the pandemic but the future, because a lot of people are not working right now.
Sure, I think it's a really valid question, and it brings us all the way back down to the foundation. The viability is very strained and stressed right now for both the parents and for the programs that are trying to run. So all of these new mandates, requirements to get our spaces healthy and safe for our staff and our children and our parents comes with a cost. So the viability for programs that may not have those resources to get themselves up and running with compliance is definitely an issue. I think access to education is a civil rights conversation that needs to transcend the city through the state and all the way into the federal government. Accessibility to education has to be approached so that all people have access, no matter what their income is, no matter what their personal resources are, but be able to rely on the community to get the needs that they have met on a regular and consistent basis. And now that this is new, we need to also consider contingency plans and funding those contingency plans to support programs in order to support the families. They have lots of different choices that they have to make. Some parents are making choices between having to stay home with children or having the possibility of losing a job. And that is never a choice that people in this country should ever have to make. So we really need to drill down to that point and really think about how do we restructure this so that we're not opening childcare centers too early to accommodate people to go to work. We should be opening childcare centers because it's time to open them, because it's safe to open them, because we want our children to continue their social, emotional development. We want to continue to be beacons in their communities, not just as filling a need for the economy in terms of people have to get back to work. I think the bottom line for a lot of community-based organizations and public schools, private schools, we all have the same goal. We all want to return to some kind of normal. We want our children to be back at school. We want to be back at work. But it's our responsibility to put the infrastructure in place so that we could do it responsibly, healthy, safely, and respectfully.
Thank you. So we're getting a lot of questions about the issue of safety. And I think it would be great for you and then maybe Corinne to answer, because you have the experience of talking to those who were operating during essential workers or the essential workers. And, how can we be safe if children are not required to wear masks? One teacher said that at her center, there are 15 children and they actually don't have the space for that. And in fact, they actually have 20 children just because, I guess, of the need. So they want to know, how do the guidelines work, for parents and family members dropping off. I know that today at a discussion with the governor's office about the state ed, it was left open, how each school, and this might be true of each center, to decide how they want to drop off or have a visitor policy. I know you indicated when you spoke, Maya, that it was drop off. And then of course, what about, picking up children? And if children are not required to provide a negative COVID test upon entry, how else can we ensure safety? And again, it may be different. I'm more familiar with what the process might be for DOE. So I was just wondering from your experience, and Corinne, you could jump in also, how it worked for the essential centers and how it might work for many more in the future. Just basically safety in all fronts, from masks to drop off to social distancing. It's nice to have it on a piece of paper. It's hard sometimes to have it in real life.
Exactly. I think you got it. Like, I think that there's going to be, as centers reopen, there's going to be a push and a pull on what we know is developmentally appropriate, what's best for children, and what is most important for public health reasons. So we found in our report that both for the family childcare providers and the centers, families did do drop off in front, outside of the centers or outside of the homes. They did not enter into the centers. I realize that this is really counter to what we know to be developmentally appropriate. I mean, dropping off a baby essentially can be very emotional, especially at the beginning of the year. And so there needs to be some discussion around whether or not that makes sense for that center. We did find that nobody got sick, not the kids, not the parents, not the staff in any of the emergency childcare centers. So I think that says something about the procedures that have been put in place to keep everybody safe, that they were working. Recently, there was a case up in Syracuse where there was an asymptomatic child and there was an outbreak. And in that case, it was a family childcare home. The parents were allowed to go into the home. So I think that there's a lot to be extrapolated from that as well. Children did wear masks, at least the 3 and 4-year-olds in the emergency childcare centers. They did not wear them the way they're supposed to because they are 3 and 4. So they talked about how children would take them off. They would, grab and pull on them. They had to be reminded several times throughout the day to keep it on their face. But they were able to do it. There wasn't any fighting against it. It was more they just would forget and they would take it off, and then they have to be told to put it back on. Children under the age of 2 do not wear masks. All the staff do wear masks, and in some cases they'll change masks throughout the day, or they'll wear one to get to work and then they'll change it when they get there. In some cases they were asked to take off their shoes when they arrive and either wear slippers or tread socks, but they were told not to bring things into the center essentially. And some staff would change into scrubs like a nurse or a doctor would when they go to work at a hospital. So there's a lot of practices that have been put into place, and I think that they've been done effectively, especially since nobody has gotten sick. But again, like I said earlier, the question is whether or not these practices are scalable when you're talking about opening up thousands of childcare programs across the city.
Corinne, what do you think? And there's also the question of the negative COVID test. I know in some cases one does it at home, sometimes temperature coming in. I love that machine that you step into and it takes it instantaneously, but that may not be cost effective for every center to purchase. So what also, just maybe you could talk about the scalability of some of these issues from the DOH perspective.
Sure. Well, all of the strategies that you just heard about are really good ones. And as I said at the outset, really what this is about is variations on the core 4. So that's what we're all learning to do, to stay home when we're sick, wear face coverings, stay 6 feet apart as much as we can, and keep the hands clean. In terms of health screenings, New York State does require that before children and staff come into childcare every day, that they do a screening. It can be done at home. If it's done on site, it creates other issues that the child care program would have to implement to maintain social distancing and reduce risk of an on-site screening. So it's possible to do it at home. And that's one of the things that families are going to need to do. We're going to need parents to make sure that they're doing that screening every day and not bringing their children into childcare when the child has a symptom. But I agree, we were not aware of any outbreaks in the emergency childcare programs this year, in the last few months, and I think it is a tribute to those programs implementing these mitigation measures. And I think, you know, this is what we have to learn to do over the next many months. We are going to be living with COVID-19 for many, many months. And all of these measures, which really come down to variations on the core for implementing, making these our habits every day. You walk out of the house with your keys, you walk out of the house with your face covering, with your hand sanitizer. That's got to be our way of life. And if we're going to get the benefits of childcare for our children and for our families, then these are the strategies that we will need to learn to implement.
Just in terms of PPE, which is what I think I've been doing for the last, many months, is getting it and distributing it. Is that something that small business services is
Yes.
going to be can you just talk about that? Because actually we got some pre-questions on that topic. Where do I
Sure.
get, because it does add up cost-wise.
Yes, sure. I'm having an internet problem. Oh, there we go. Yes, Small Business Services is providing a marketplace for small businesses. We've actually, when we have sent notifications out to childcare programs about the New York State requirements, about our resources online, our checklists, our FAQs, our tools, we have also let childcare programs know about SBS and the resources that they are making available to childcare programs. So we do urge childcare programs to visit SBS and learn what's available.
Well, is that free PPE or you have to pay for it? That's the part I don't understand.
I would have to check if it's free and low cost. I'm not sure. So we'd have to check with SBS.
Okay, because that would be something that, people would like to have it for free. So that would be something to, and then of course,
And we can send around a link to that. And we also, the other thing we let childcare programs know about when we communicated with them a couple of times is that New York State has a grant opportunity open to help offset some of the costs. And so we have let childcare programs know about that. There's an application deadline, which I don't remember and I don't want to misspeak, but we have referred childcare programs to that.
Okay. And so I guess that would include all the cleaning protocols and also the cleaning materials too. That's all part of the PPE world in our new normal.
So these are new things that childcare programs will need to do. There are enhanced cleaning protocols where childcare programs will need to do frequent cleaning, particularly of high-touch surfaces, and toys will need to be cleaned frequently. There is a strategy, as you heard, of using kind of smocks to be able to quickly change clothes and keep things clean. So it's true that these are new costs for childcare programs, and we urge people to go to SBS. And I'm getting a message that it is free and low cost. Items are available through SBS, so we recommend childcare programs visit those and see what's available.
That's good news. Dr. Rao, I know you talked a little bit about this, but there is always the question of, in the United States, trying to think about this childcare system that's more equitable, more supportive of working parents, as you suggested, particularly of us women, and just more resilient in times of crisis. Let's hope we don't have a second wave. I'm glad one of my kids lives in California, and we were looking like idiots, and now they look like idiots, at least in my book, in terms of the second wave that they've had to encounter. So how do we try to become more resilient? Are we going in the right direction to try to do that? It is, as somebody has said, a little bit like learning to fly a plane as you are flying. But I do think that we are going in the right direction, but childcare is just one portion. So I just want to get your thoughts about the future and be more equitable and trying to figure out how to be even more supportive of families and more resilient.
Mm-hmm. Well, I wish I had a blueprint to suggest for our great city. We have a very big, very diverse city, and people like, some people prefer center-based childcare, some people prefer family-based childcare. The bottom line is, and I think what you're saying is, we need more support in this arena. And, you know, I sound like a broken record, but I have to keep going back and saying, this is a systems problem. And it really requires a will and an effort on the part of our city, if not our country, to develop policies, I think, where everyone has an opportunity for affordable, high quality childcare, to enable them to go out and do what they need to do in the world. And I see it as a systems problem, and I also see it as very importantly community-based, because I think that that's where we've got, you know, the diversity, the unique preferences of communities. We have various faith-based communities. We have all kind of geographic neighborhoods. And I think we need to perhaps reinvestigate how we provide all these backup services for families. I think there are other countries that do a better job of this, pay more attention to maternity, paternity leave, are more respectful, I think, about the parenting, the job of parenting. And I guess I'll just say that as a society, we don't particularly reward childcare providers or even teachers. We have particular kinds of pecking orders and reimbursement for work. I really hope that the pandemic has just absolutely hit home the critical job that these folks do in our communities and in our society. And I think we really have to rethink about how we reward that. It's just something that's been coming for a long time. I would be, you know, sorry to say if a crisis pushed us closer to a solution. But there is a lot of parents out there who, once they were suddenly asked to homeschool and to supervise children for hours and hours every day of the week, recognize what teachers do and what childcare providers and child staff do. It's remarkably difficult, and it should be valued and rewarded in our society in perhaps a more obvious way.
I totally agree. In fact, Dr. Page, I was going to ask you about the teachers. Obviously, we have all been pushing for more funding. Some of them are different unions. The managers are one union, the teachers are another under childcare, but never enough money. And so I'm wondering, do you think, as Dr. Rao stated, that we might have a new thought process about the incredible support that should be going to childcare teachers? And I could talk about the DOE also, but we're talking about childcare today. Certainly the unions have been pushing over the years. I think I've been to, I don't know how many rallies for childcare centers on this topic. But, and also now, of course, we have the situation where the teachers want to be healthy in addition to the parents and the children. So are we having a new normal discussion about teachers, do you think? And also, are the settlement houses in general, to the best of your knowledge, finding that teachers want to come back to work? Just generally, the support in terms of the staff, how's it going for childcare?
Sure. Thanks. I couldn't agree more with Dr. Rao and your assessment. It's always timely to talk about how to compensate educators commensurate to their training, their certification, their degrees, their experience. We're still far and apart from where they need to be, even though there was a small victory last year in some salary parity for the early childhood educators. That was not the end. That was just the beginning of the conversation of getting folks to where they need to go in terms of being properly compensated for the work. You know, quite frankly, I don't think just educators, but folks are a little bit trepidatious about coming back. Folks are confused as to why early childhood has an potentially earlier start date than school buildings. So there's a little bit of discourse, conversation, if you will, about that. Teachers are also parents and caregivers of aging parents and grandparents. And so coming back to work for our sector is not just coming back to work, it's trying to figure out all of the things that we have mentioned that our parents have to do, our workforce has to do the same thing. So there's a lot of anxiety attached to any type of return date because they have to get their families situated. They have to also be prepared and trained and feel safe in the spaces that they're going into. And just be concerned about what happens if I do get sick, what's going to happen to sick time and potential liabilities that we have not had to think about. This is a pandemic of new thinking and new situations that we're in. We've never had to think about certain liabilities before. So those two things together is really creating an opportunity for the folks who can make a difference probably should come back to the table and talk about how do we make a difference, a real difference, and honor the educators in the way that they deserve to be honored.
Thank you very much. So a lot of questions are coming in on the chat, as you can imagine, with what Michelle talked about, which is why did the childcare start prior to phase 4? The governor has phase 1, 2, 3, and 4. Phase 4 actually starts on Monday if all goes well and the metrics hold up. We'll have to see because we never know. But my question to you is mostly on not so much about why I started earlier, because the ones you were talking about were in session during the entire COVID. So my question is, how did the essential workers, that's what your teachers are, how did they take days off? How did they survive during this COVID period in terms of their teaching? And were they out? Did they come back? How did all those teachers work? And are there, again, some suggestions for this opening for all the other centers about how teachers can or cannot be supported? Obviously funding, and I'm a huge supporter of more money for teachers in general. So again, you have so much to offer for the rest of us who are opening up these centers. So I'd love to hear more about the staff.
Sure. So I think it's important to note that the staff of the emergency childcare centers were all volunteers. So they got paid, of course, but they willingly worked at those centers. They said, this is something that's really important. I can contribute. I want to be a part of this. That's very different from childcare centers opening in August or September and staff being told you have to come back to work. So that, I think that we need, when Michelle really hit the nail on the head when she talked about the complexities of our staff's lives is, they're caretakers, they're parents, they are members of a community, and to set out a reopening date without a broader conversation about what these centers need and the staff need in order to reopen, I think is, it's just too early. The staff at the emergency childcare centers were also provided with a lot of training too ahead of time on how to disinfect, how to do spacing, how to properly, even just wearing a mask the right way. So they were prepared for it and they were willing to do it, but we need to make sure that we're not putting staff in a position where they feel like they're going to lose their livelihood unless they go and go back to work. I think that there needs to be a bigger conversation about that. And it also needs to involve the union, because the public funded centers are represented by DC 37, and that includes Head Start as well. And so just like the U of T has been there to fight for the public school teachers, you know, DC 37, we haven't even had a conversation with them yet about what reopening looks like, what are the staff's rights, what does furloughing look like. There's still so much more to be discussed.
Okay.
I'd like to jump in one, if you don't mind, to just
Go
kind of
ahead.
piggyback off of that as well, and say that part of this conversation needs to include support for the staff and the families, but the staff who have also been part of this pandemic. We've had, you know, racial discourse on top of the pandemic. So a lot of our community, our staff, our educators, our leaders, in addition to the parents, are going through some type of trauma. And to reiterate what Maya said, to say you have to come to work without having a comprehensive conversation on how to support that is a little frightening for a lot of people. And we need to really put that at the top of the conversation.
Yeah. So poor Corinne. So everybody is wondering from, you know, I think the issue for the city and the state was the same conundrum of, you know, you've got the viability of the center and then the health. And now you have the other conundrum of parents having to go back to work, even if they have flexible schedules, which is what the business community is urging the companies to do, then you still need childcare. And so that's another conundrum of the center is not open, I can't go back to work. So I assume that the pressure of the business community is kind of what pushed the centers to open or to be able to open before the schools. Is that kind of correct? And before
No.
stage 4, I should say, or maybe I'm wrong.
No, well, no, childcare in New York State is not tied to a phase because childcare never closed.
Yeah.
Childcare was an essential service in New York State.
Yes.
And so New York State said childcare programs don't have to close. In New York City, because of what we were seeing with widespread community transmission, and everyone remembers back in March and April, and so we saw that, and we said to the board that we think we can help slow the spread of COVID-19 in New York City by closing childcare as an additional mitigation measure to all of the things that were happening in the city at that time. We saw that childcare programs did continue to stay open to serve children, even children who were not of essential workers. And so we went to the board with that recommendation, the Board of Health. The Board of Health agreed that would be a mitigation measure. But now we're not in that situation anymore. We have now slowed the spread of COVID-19. There is still transmission, but the transmission rates have slowed enough that there's no public health reason to mandate that these businesses be closed. And so the closure order was temporary. It was a mitigation measure. That mitigation measure is no longer needed. And so the board lifted that, saying to childcare programs that you are a small business, here are the requirements you need to follow to be able to open. When you're ready to implement those, you can do that. We heard from many, many childcare programs asking us, when will we be able to open? Transmission has slowed. Our families are calling us every day. They want to be back in our care. And so as a public health measure, requiring childcare programs to be closed was no longer necessary. And that's why they're able to open. That doesn't mean that it's the right thing for every program. Every childcare program director has to make that decision. Look at the requirements, see if they're ready, train their staff, absolutely. But that's why.
Okay, that's very helpful, because in New York City, if there's an X, there's a Y, and if there's a Y, there's a Z, and I'm stuck with all X, Y, and Z's with all of their questions. But Maya, there's a question to learn from the emergency centers about social distancing. How do teachers do it? How do children do it? How can it be enforced in a therapeutic setting? What's the best way for children to share spaces like gyms or playgrounds? You know, kids are very affectionate. And I just want to know, how did it work, and what do you suggest for the future?
So we found in our interviews that every center and every family childcare provider did social distancing differently. So it doesn't look the same across the board. There were classrooms where kids were paired up with someone and that was their buddy, and they stuck with their buddy all day long as a social distancing measure so that there wasn't congregating of different kids all together in one group. Those kids were moved from station to station to station so that they're not all like running across the room together. In some family childcare programs, they bought larger tables so that the kids could sit further apart. Um, it's done differently depending on what the actual physical buildings look like, what the homes look like. Obviously, the staff cannot social distance from the children, but what they can do is keep staff contained to that one classroom. So, once upon a time, maybe there were floaters who would come in and out as a teacher needs to go to the bathroom. Someone would come in. That they try to keep that to a minimum, but you can imagine even with just that example I gave you, like someone needs to go to the bathroom at some point and how you're going to maintain the ratios for that classroom. So, every center kind of had to figure out these details and what worked for them. So there isn't going to be a one solution for every center, unfortunately.
No, does anybody else want to jump in on the social distancing? For some reason, a lot of people asked it, although a lot of centers have outdoor space too, right? I mean, that's also very helpful.
I mean, we did find that out of the centers that we talked to, only one of them had a private outdoor playground. And they were able to power wash it every night with a cleaning solution. But a lot of our centers, for example, are located in NYCHA facilities, and they share playground with the NYCHA residents. And that's not going to be allowed, obviously, because it's a shared space. So, and gross motor play is such an important part of the early years. So I think there's, like I've been saying, there's still so much to be figured out. We actually asked the center directors, do you think you could create new classrooms to accommodate social distancing in your gyms or something like that? And they're like, no, we need the gyms for gross motor play. That's a very important part of early childhood. So, space is very limited. I don't have an answer, I feel like.
Well, you have so much experience with the essentials, though. It's so wonderful. Corinne, there's a lot of questions, and Michelle, you might help me too. The folks who are calling in or writing in on the chat room, they want to know about liability. This is the same problem that we've had with any private enterprise, no liability coverage for COVID. So what's being done to provide liability immunity for contractors, if that is something that and then who will bear the liability of a family contracting COVID if it's at a center? Now, I guess, Corinne, you could start, and Michelle, you probably have the same problem at university.
Yeah, so I'm not really going to be able to answer that. It's definitely a question we're hearing from not only from childcare providers, but all kinds of businesses. But it's really not for the health department.
Okay. Michelle, does that come up at university, or it's something that hasn't come up yet?
I think it's starting to come up now that we're starting to have conversations about what it's going to look like to reopen. We're waiting for some guidance, just as the rest of the early childhood field in the city, and hopefully we'll get some information soon to help us make some decisions.
I assume, Corinne, that if a teacher is sick, I just want to know how you do the isolation for the teacher, for the student, and paid sick days. I think it's the usual law of the land. That's my bill, so I'm very proud of paid sick days. I love when the mayor says he did it, but I took all the hell on paid sick days. I remember they used to tell me, I used to say it exists in San Francisco, and I was told San Francisco is not a city, Gale, so please don't compare us, so don't even discuss it. But I'm glad that it exists. And then also, in addition, nurses are what status in terms of childcare? I know how it works at DOE, but how does it work at childcare?
So first, thank you so much for your leadership on sick leave. That is certainly key, and I think this is a moment when we are seeing how very important that is, and we have been really encouraging employers to make sure that they create a supportive environment for their employees to stay home when they're sick. That is one of the key, one of the core four that we all need to stay home when we're sick. And so paid sick leave is critical. There were a lot of questions in there. Let me see if I can remember. So one of the questions was, if somebody gets sick in childcare, what happens? So what will happen is that that group, that classroom, whether the person who is sick is an adult or a child, that class will be quarantined. People will need to stay home and not come to childcare for 14 days. So that's part of what you heard my talk about how important it is to maintain stable groups. So that's one of the key strategies as in a risk reduction, is to keep those groups stable, so that if there is a person who is sick, you are containing that. And you heard that we did not see any outbreaks in the emergency childcare programs. And I think it was in part, could be because they were so successful in maintaining that stability.
That's a great answer. And then also for you, but also Dr. Rao, you may have some ideas. There are state regulations, city regulations, and then I don't know, the CDC guidelines. I know that you are all trying to match them. Is that something that's matchable, or does it take some more time to figure out how they all work together? So start with Corinne, and then maybe Dr. Rao, you may have some suggestions based on all of your being on so many different federal boards. Because it is hard to see how they're all going to line up.
Yeah, so I would say a couple of things. For childcare programs, New York State has issued the requirements for COVID-19 mitigation. That's what needs to be followed. To the extent that there is any conflict with a New York City childcare regulation, then we would yield to the COVID-19 mitigation measures. I don't think there are any that I can think of off the top of my head. But it is true that we have all been living through different kinds of recommendations coming from different places, and that speaks to this. This is a new illness. We're learning about it, and we're learning as we look to California and other places. We're also learning what's working and what's not working in reopening. And New York City has opened more slowly, and that's why we thought, given what we are seeing in transmission, lower transmission in New York City, that we were able to allow childcare programs to open if they're ready.
Yeah. Dr. Rao, I didn't know if you have a lot of experience working on different levels of government, and I was wondering if you could comment how, in this very complicated, changing world, how all three levels of government can work together in childcare.
Well, I would really defer to Corinne about that. I mean, I think that right now we're having trouble with consistent messaging with the country in general, and I think that may be a function of leadership at different levels. Certainly at being a resident of New York City, there are always differences and tensions between city and state regulations. And I just think it has to do with the nature of New York City, which is practically a country on its own. So I don't know that I can answer anything else specifically about the consistency of regulations. It would be terrific, frankly, if people were easier to work together, and so that the messaging were very much more consistent. But honestly, it's not really what we're seeing, and that goes all the way up to the national level. And certainly the CDC guidelines are occasionally at odds with federal and local guidelines. So it does get complicated, and I have nothing to suggest in terms of being able to pull the policies and the regulations together. Again, I think Corinne would be a little more at the epicenter of those sorts of problems, although I'm just not sure there are a lot of solutions.
Yeah, I agree. So Michelle and anybody else, I don't know if you have home-based, I don't know if you have Head Start, but obviously those are part of the bigger childcare world. And I just didn't know if you have other suggestions for those two types of childcare. A lot of parents I know during the pandemic were worried about starting work not having childcare and went to home-based. Sometimes it's legal, sometimes it's not. That's a challenge. I was wondering about what was going on at university in that realm.
Sure. So University Settlement does have a family childcare network. We're happy to announce that we're also going to start expanding into Brooklyn in addition to our Manhattan programs. And I think the concern with parents was consistent across home-based and center-based because of the unknown. Folks were concerned about safety and transmission, contact tracing. So we did see a dip in enrollment in the family childcare networks as well. They're starting to pick up this week, which is great news. One of the things we're fortunate to also have early Head Start grants from the federal government, and their guidelines, as you know, are very strict, and they do overlap somewhat with Department of Health as our licensors, which also you have to fold in the Department of Education. So there are many community-based organizations that have to take not only the Department of Health guidelines, but the guidelines from the state, the standards from the feds, the guidance from Department of Education. And as Mai had mentioned earlier, a lot of our programs are in New York City Housing Authority. So we have to really take all of these regs and see where they overlap, adhere to this more stringent guidelines, because that'll hopefully help protect us a little bit more. But I think the takeaway part of this conversation is that all of these entities on the city level or the federal level or the government level have to be on the same page, because what happens is programs are caught in the middle of varying conversations and ideas of what should happen. Even though there is outlined guidance, those entities have to be in alignment as they are supporting us.
So I do just want to add, thank you very much for that. In terms of the COVID mitigation requirements, it is New York State that has issued those. And that we have sent those to all of the childcare providers. And we have in New York City at the health department, we have very intentionally not issued any additional requirements, not only because the state has covered that, but also for the reasons you said. New York State has issued the requirements, and so we have seen our job is to help providers comply with those. So we're giving tools to support your compliance, to help fill in gaps so people can understand where New York State has left issues out. We're filling those, but really have tried to leave the requirements to New York State. They have issued a very, very comprehensive set of requirements. And then on the city level, helping to provide tools so that you can comply with those.
Yeah, totally agree. Thanks for that clarification. The point I was trying to make was that the Department of Health also has Article 47, which we still have to comply with. So that's when I was thinking of the regulations from the state have to also kind of marry with what our already existing guidelines are. So one of the questions, one of the questions that comes up often is, we're required to have certified teachers on site, not just on staff, but on site, and certified program directors. What will be the response from the city, if you will, if that person has to stay home for 14 days? Will there be non-compliances? Will there be violations? So it's kind of looking at all of those different documents and trying to figure out how they fit.
So you guys are experts. It is unbelievably complicated and unbelievably important. I have a sort of like a home-based kind of question. Somebody wrote in, they have art classes in a studio or a art studio, and they don't know if they can begin classes again. She has 5 children, ages 5 and up. Now, this is not childcare, but it is a question, does somebody allowed to do that? I guess that would be a question for the Department of Health, but also just generally, if you could talk in about the home-based also, where we at with home-based.
Sure. So I think for the particular question about a person who has classes, I think we'd like to get more details and follow up individually. Don't want to give advice without having the details.
Okay.
And home-based providers, those are New York State regulated, and you may have been hearing that people were seeking out home-based providers in part because they did not close. So they were able to stay open, and parents who needed childcare were able to continue to use home-based childcare providers. And Borough President, I also heard you say that sometimes people turn to informal care because they needed childcare, and that was another reason that we went to the board, because we knew that parents were starting to do that. And so our preference is we don't want parents to turn to illegal and informal care. We want them to have access to regulated childcare, certainly an equity issue as well. So New York State, the home-based providers also have to follow these very same requirements, and it's the state that is doing more of the outreach and education for those programs.
Right. Thank you very much. And I totally understand. So Maya, there's a question about your emergency experience. How were lunch breaks covered? And how are you able to use substitute teachers, if at all, during the essential worker?
So there wasn't any discussion about substitute teachers with the essential childcare program. For lunch breaks, they talked about no longer serving meals family time, which actually runs counter to some of the guidance that if they're part of this, the state CACFP program, that's the child and adult, I'm not going to know the acronym very well, Child and Adult Food Program. That runs counter to their guidance, which says that that meals should be served family style. That's not the case anymore as a mitigation effort. And there are some family childcare programs that moved to using, like disposable plates and forks and spoons, for example. A lot of these strategies were not specifically on paper, like you should use paper plates and plastic utensils, but that's what they've had to do, is kind of figure out, well, this is what I think makes sense, and I think it's consistent with what the guidance says, and so I'm going to do it. I think that's what every center is going to have to do, is within the guidance given, what are you able to do, what are you comfortable doing.
And I think what you should do is take all the wonderful essential workers that are in your report, and they can make extra money as being, experts. I know that's my craziness. Corinne, there's another question that we had gotten earlier too. Because of physical distancing, programs need to have classrooms added to their licenses. So is there a timeline for Department of Health to inspect and measure the rooms and approve? I think providers feel they need to do this before they open. And I know you probably have a backlog, and that's always a challenge. So, but that's a big question.
Yeah, we are anticipating that some programs that do have access to additional space at their facility may want to do that, and that's great. And I would just encourage you, just be in touch with your borough office. I can't speak to a timeline now, and I think that things will change as more programs figure out that that's what they want to do. So be in touch with us, and we'll work with you.
Okay. Dr. Rao, I know you talked about Head Start in your background. I'm a huge supporter of Head Start. It's always a challenge sometimes with the federal government. But are all of these wonderful aspects of action all applicable to Head Start? Obviously, it's a federal program. Is there something else that is applicable to Head Start, or is it just following the usual guidelines that we discussed?
So those are great questions. And I think that Head Start does have its own set of requirements, which is not to say that it wouldn't be consistent with what the city needs. One thing that's very different about Head Start, and is a very important part of Head Start, is the inclusion and involvement of family with parents as part of their program. And as you know, Head Starts take on the complexion of their neighborhoods and their communities. So they are typically located in and of a community. I think it does present some challenges because of the in and out of family members and parents who participate actively in Head Start programs. And I would, although I really don't know exactly what the requirements are going to be, but I assume there's going to be a protocol. Maybe Corinne, you would know this, for screening and testing for for parents who are going to participate in the day-to-day workings of the Head Start agency or the Head Start site. Corinne, do you know how they're going to do that in terms of assuring or requiring masks and a whole variety of things?
No, I haven't seen the particular Head Start requirements. The New York State requirements would require, if a parent is coming on site, for that parent to do that same health screening. And I think we heard from some of the suggestions from what the childcare providers did in your study, that they did really do drop off and pick up outside the centers. And I think a lot of programs will do that. I think we will see less parental involvement as a mitigation strategy. And these are all trade-offs, developmentally important to do that, but we are also need as a mitigation measure to do less of that. So these are going to be choices, and sort of we're all kind of making the best of this situation.
Yeah, it's hard.
I'd like to
Go
jump
ahead.
in and answer some Head Start questions. So, one of the pillars of Head Start is family engagement and collaborative decision making. So while
Yes.
parents being in the spaces may look different, the parent involvement is not going to go away. It's actually probably going to ramp up. Programs that are licensed by Department of Health, regardless of funding, so Head Start, Department of Ed, private, if you're licensed by Article 47, we have to follow the guidance. So we will be following the state and city guidance in terms of center-based and home-based. And, keeping in mind that parents do have a couple of different choices. So they do have center-based, they do have home-based, and they do have informal care, which are some of the options of, family members, cousins, babysitters. So not quite illegal, but just more of an informal choice. So we still have to, as Head Start folks, programs, we still have to adhere to the state regs.
Okay, that's very helpful. Obviously, vaccinations have not happened yet with COVID, but parents want to know to ensure that other children in their program have been immunized as per the usual routine of vaccinations. I assume you do that anyway on a regular basis, but people are more attuned to it than in the past. So how is that information, I guess start with you, Michelle, how was that information conveyed and how do you handle it? Because, like I said, first of all, people couldn't get to a doctor for months and months and months. And, and it's hard to make an appointment, et cetera, et cetera. So I just was wondering, how do you handle that?
So we've anticipated this, as we have checked our records to see which children's immunizations have been up. We've been constantly contacting parents and keeping them abreast of the immunization schedule. And we've made it clear that before the child can go back into any kind of center-based or home-based program, their immunizations need to be up to date. And if there is some kind of lapse, there is a catch-up schedule that they have to adhere to kind of get them back on track. The staff have to follow the same guidelines in terms of having their medical information up to date. Anything that was mentioned in our the guidance from Department of Health's Article 47 will still be in place when we open up eventually. So parents have been given the heads up to try to get those appointments made.
Corinne, is there anything you want to add? Because I think that was pretty comprehensive, but I didn't know if there's anything you wanted to add.
Yeah, no, that's really terrific, and would urge childcare providers to follow Michelle's example. We did initially see a drop in vaccinations among children. It's such an important question. I appreciate the person who asked it. We are seeing vaccination rates go back up, so that's terrific, and it is a requirement to enter childcare that children be on schedule for their immunization requirements, just as you heard from Michelle.
Okay. Obviously, at the city schools, there may be some blended learning. That's not happening on the childcare, I assume. So I was just wanted to be clear, when we're talking about childcare, it would be perhaps fewer numbers of children in the center, but it would be the regular days and hours. Is that, Corinne, sort of what you're thinking is going to happen in terms of most centers, or is it up to the center to decide?
It is up to the center, and we do know that there are some centers that are doing a combination, have been doing remote learning, and so some may continue to do that. They may do a combination. This is really up to the center to decide. That, you know, the New York State requirements don't prohibit remote learning, and we expect some programs may continue to do that.
Okay, Dr. Rao, because you are the one with the big picture, which I love. So obviously we needed more childcare before the pandemic. And now, you know, there may be fewer options. There may be, it's hard to know, but how do you think, maybe it's a business community, we can do what you suggested, which is to have more quality childcare in our country, not to mention our city. I know it's a very big question, but I always would go back to the business community because people listen to them. But I didn't know if you had some suggestions about how do we do all the things that you suggested when you were speaking originally.
Well, I mean, I think that, you know, much like I would advocate for universal health care, I certainly think we need some sort of universal policies related to childcare. I don't know how we'll do that. In the interim, it seems to me that there are a lot of places where childcare naturally is paired to the workplace, for example. And there are a lot of very good examples where people in their own neighborhood or in their own place of business can access childcare that's affordable and is something that becomes, let's just say, more of a right rather than just a privilege, something that everybody has access to. And I know it's come up quite a lot in our discussion about these issues about equity. And I think, you know, that has a lot to do with affordability and the way the system is structured. I think that our country has a long way to go there, but we are also at a very important time in terms of, I think, you know, citizen awareness of inequity and some of the real structural problems we've got in this country in terms of disparities. And so maybe yet again, we could use this as an opportunity to rethink how we're going to fund childcare, where we're going to locate it, what we're going to link it to, and perhaps begin to regard childcare as more of a right and less of a privilege. It's an essential service. And I think we have to learn how to put working parents together.
Thank you so much. Couldn't agree more. We don't have much time left, Michelle, but one of the questions, of course, that I get all the time is, how do you make an informed decision about childcare? And I know that you get parents that are trying to ask you, they need more information, they need more resources. Obviously, anybody going to university is going to be very pleased, but just generally, because you're on so many different boards, how do people find out about what's the right decision for childcare?
Well, thank you for the confidence in the settlement houses and university settlement. This is a very daunting task to try to figure out what to do. I think that the first thing we are doing is looking at all the information that's available, that's reliable, that's valid, that's out there. You know, things like Maya's report is really helpful to start the conversation in, you know, what interim care was looking like. We're looking at our standards, we're looking at Article 47, but most critically, we have to listen to our parents. We have to give them a variety of choices that works for them. We have to listen to our staff and give them accessibility to come back to work, understanding that they're integral in getting us back up and running, but we want to be healthy and safe about it. And we need the partnership of all of the stakeholders on the government level, you know, to fund these new things that will need to be implemented. You know, current situations need to be funded. Future plans need to be funded, and any kind of contingency plans when we look at the possibility of having to shut back down, which I hope that's not the case. But the reality is that it may very well happen. So looking at all of those things and really try to make the best informed decision. There's no perfect decision. Is this the best decision that we have based on the information we have and in partnership?
Thank you. So Maya, you have the last word. And I would love to just very quickly hear from your experience with the parents and the teachers. What do you think they got most out of in terms of the amazing childcare experience they had during the pandemic?
Well, I think that from what we heard from the providers we spoke to, the parents felt just a great deal of relief that they could leave their children in a place that was safe, in the hands of providers who cared for their children, who were being careful, who had not only the safety of their family in mind, but also their own staff. I think that what it came down to was everybody was kind of looking out for each other. And I think that's really essential. I'm a parent myself. I would need to know that my center is being safe, and that's what I would need in order to leave my kid there. And I think that those essential childcare centers were doing just that.
I want to thank this amazing staff, Corinne Schiff from the Department of Health and Mental Hygiene, Dr. Virginia Rao from the Mailman School of Public Health at Columbia University, Dr. Michelle Page from University Settlement, and Maya Mixick from the Daycare Council of New York. And if you have any questions, you should go to neighbors.columbia.edu/child care after COVID. Thank you all very much. This was a phenomenal panel with lots of great information on perhaps our most important issue, childcare in New York City. Thank you all very, very much.
Thank you.